Welcome back. With me today from Harvard Eye Associates is Dr. Diana Kersten. Always good to see you. Welcome back.
Thank you. Thanks for having me.
We get to see you. You usually come on, what, about every 3-4 months or so.
Mm-hmm.
So great to have you here today. And you're going to tell me about something that the doctors at Harvard Eye are doing that is really a great community help, and as you were just saying before we got on, something that's very rewarding for the doctors.
Yes, very rewarding. We're having 2 days of free eye surgery for patients that are needy and uninsured. We're calling it Operation Restore Sight. And it started in kind of a very cool way. This is our crowdfunding page I'll talk about. But there's these wonderful nonprofit groups locally. One is St. Joseph's Neighborhood Health Center at St. Joseph's Outreach Center, and the other is called Serve the People. And both groups take care of needy people that have no insurance. And so, of course, they sometimes have patients who need cataract surgery or need other eye surgery, have glaucoma. And so most of us at Harvard Eye have been seeing, you know, one patient a month and doing a couple of free surgeries as we go. But when I had a patient in December, and it was a young 43-year-old gentleman who was a single dad who had these growths on his eye called pterygia that grew right over his pupil.
Okay.
So within a matter of 6 months, he became 2400 or legally blind in both eyes, and he lost his job. And he was the most lovely, you know, gentleman. And so he was referred into me in December. So just before Christmas, I did and the surgery is actually pretty simple for a pterygium. Surgery on his right eye, and he improved to 20/40. 2 weeks later, surgery on his left eye, and he improved to 20/40. He got his job back because his employer had loved him. And the kind of gratitude and the kind of feeling that you get from taking care of patients like that is why I went into medicine. I love taking care of patients in general, but it was such a great feeling, and I think we're all finding that. So basically, we found out that these 2 groups have a backlog of about 70 cataract and pterygium patients, and we're doing them all in 2 days, and that's Operation Restore Sight. We just saw all the patients in this is a Saturday. We worked, and all our staff are volunteering. They're in the back. We saw all these patients on Saturday and basically did all the testing, got them ready, calculated their implant powers, went over their risks and benefits. I can only show this because they all signed waivers. Usually HIPAA, you couldn't do this, but and these are just some of the sweetest people that have no access to health care and really bad cataracts and really bad disease. So on April 26th and May 17th, we're doing their first eye and their second eye. So much has been donated by Alcon and Bausch and Lomb, and
that's great.
Surgical Eye Expeditions has gotten involved. They're donating the eye drops and an extra microscope. But we do have a crowd funding page because there's going to be a few $100s that, you know, it's hard to get some things donated. So any patients or our your nice viewers who are interested, this is Crowdrise, and I can kind of explain it. It's a little site where you could go in and give $20 or anything.
I haven't heard of that one, Crowdrise.
Well, Surgical Eye Expedition set this up. And I wouldn't have really set this one up exactly, but they're a nonprofit group. So when you give, you're giving to a nonprofit group. It's tax deductible. But if you go to www.crowdrise.com, and then on the upper right corner, you can search, and you just search my name, Diana Kersten, it comes up.
Okay, great.
And we've raised almost $2,000 already, which is wonderful. And we're all excited about it because this is why we went into medicine in the first place, was this feeling. And you get this feeling with taking care of all patients, of course, but it's something special when they wouldn't get the treatment otherwise.
Yeah, and it's something that your sight is your sight. So, you know, there may be other things that people need that don't have access to a lot of great medical care, and they may need them for sure, but when it comes to your sight, that is something that is got to be, you know, high on the priority. And as you said, here's a gentleman that could no longer do his job and lost his job because of it. So you folks went in and helped, and I think that's wonderful.
I think his whole family would have been homeless. I met his kids, and they came in with him. They were young, 10, 11, 12. So, yeah, it's just a very meaningful group. And all of us at Harvard I have done a lot of international work.
Right, yeah.
And that's very rewarding, of course, also, because the need's even more and when you go to Malawi or elsewhere. But there's a lot of patients in the United States who are not getting health care, you know, really important health care. So that's been, it's been very exciting, and it's April 26th and May 17th are our 2 surgery days, and anyone who wants to participate can go to the Crowdrise site. If you want to and you can't find it, you can always call our office, and we'll make sure the phone people have.
Okay, so it's crowdrise.com, and then go up to the search and put in your name. And do they need your full name, or if they just put Kersten, or?
Well, I checked it out last night. It's again, I wouldn't have used this particular funding site because it's a little confusing, but if you just put in Diana Kersten, it comes up to the right.
All right.
The right site. So.
Very good. Yeah. I think that's wonderful what you folks are doing.
Thank you. It's kind of regenerated me. I love this kind of project.
Well, very good, and a lot of people you're helping, it sounds like.
Yeah. Well, that's why we went into it in the first place.
Yeah.
I love doing cataract surgery. I love doing eye surgery, and so this has been very exciting.
Very good. Thank you for coming on.
Thank you. It's always a pleasure.
Yeah, always good to see you folks from Harvard Eye. And again, that's crowdrise.com, and put in Diana Kersten's name, and from there you can donate. I think that's really great.
Yeah.
And if you forget that, you can call Harvard Eye, and they'll give you that information. So thank you very much.
Thank you very much.
You take care,
Thanks.
and we'll be right back.